You know, for the longest time, we've had this really simple story about back pain. A problem with your body's structure causes a problem with its function. It makes sense, right? But what about pain that has no obvious physical cause? In this explainer, we're going to challenge that old model and introduce a new regulation-first approach that could completely change how we think about recovery. All right, so here's our game plan. We'll start with a classic case where the old model seemed to work perfectly. Then we'll jump into a modern pain problem that kind of breaks all the rules. From there, we'll uncover the missing piece of the puzzle, lay out the regulation-first solution, and finally see how this new idea can even help with old-school injuries. So first up, let's take a trip back in time to see how we've traditionally understood and treated back pain. To do that, let's look at two very different stories. First, picture a farmer back in 1910. He lifts a heavy sack of grain, feels a sharp localized pain, a classic mechanical injury. We're going to compare him to a modern office worker whose chronic pain seems totally disconnected from any physical event and more tied to just, well, stress. This brings us to the classic way of thinking, what's known as the structure-function paradigm. It's a pretty straightforward idea. A structural problem, let's say a restricted joint, messes with the body's function, like circulation. And then in turn, that poor function can make the structural issue even worse. It's this constant vicious feedback loop. And for our farmer, you know what? This model was perfect. It was a slam dunk. The treatment was simple. Fix the structure to restore the function. A practitioner would mobilize the joint, release those tight muscles, and give him some advice on lifting. The pain goes away, and the farmer gets back to work. Problem solved. But, and this is a big but, this simple model doesn't always hold up. Let's see how it starts to fall apart when we look at a more modern kind of pain. Okay, so let's get back to our office worker. There was no single injury, no aha moment. Their pain flares up on stressful days with tight deadlines, not after a workout. They just feel this general tightness, their breathing is shallow, and guess what? Medical scans show absolutely nothing wrong. The pain is very real, but a clear mechanical cause is just gone. And this is where things get really tricky. If you try to force this modern case into that old structure-function box, you end up misdiagnosing the problem. You might focus on their posture or muscle tension as the cause, but they're not. They're actually just symptoms, the body's way of adapting to a much deeper issue. So that leaves us with a huge question, right? If it's not a simple structural problem, what on earth is actually driving the pain? And this right here is where we find the missing piece of the puzzle. It turns out it's not just about structure and function. It's about the system that's in charge of them both, regulation. The old model completely misses this stuff. The office worker's nervous system is basically stuck in fight or flight mode. It's on high alert 24/7. They're not getting enough time in that crucial rest and digest mode, which is where all the recovery happens. Their body is living in a constant state of threat, and that's what's generating all the tension and pain. So this shows us the real hierarchy of what's going on. At the very top, you have regulation, the governing state of your nervous system. That dictates how your body functions, everything from your circulation to your breathing. And that function, in turn, shapes your physical structure, your tissues and joints. Regulation is the boss. So if regulation is the boss, then our whole approach to treatment has to start there, right? And this opens up a brand new path to recovery. The optimal sequence basically flips the old model on its head. Instead of jumping right in and trying to fix the structure, we start by addressing regulation. Once the nervous system starts to calm down, then we can work on restoring function. And only then, at the very end, do we address the physical structure. Think about it this way. You can't really negotiate with a body that feels threatened. It's just not going to listen. So the first and most important step is to help the nervous system shift from a state of defense to one of safety and ease. This is what allows the body to finally relax and become open to change. And once the body feels safe, that's when the magic really happens. Muscles start to let go, circulation improves, breathing gets deeper, and now any structural work, like improving posture, isn't a struggle anymore. The body actually integrates these changes naturally, and most importantly, they stick around. So let's bring this all full circle, because this new model doesn't just throw out the old one, it actually makes it better. It creates a unified theory that works for all kinds of pain. But wait, what about our farmer? His problem was totally mechanical, and the old model seemed to work just fine for him. Or did it? Let's ask a really provocative question. Could his recovery have been even better? The answer is a big yes, because even a simple physical injury triggers a threat response in the nervous system. The body tenses up, it guards itself, it anticipates more pain. By starting with regulation, by calming that threat response first, any structural work a practitioner did would have been easier, required way less effort, and been much more effective in the long run. And that's really the powerful conclusion here. It doesn't matter if the pain is coming from a stressful job or from lifting a heavy object. By putting regulation first at the very foundation of our approach, we're working with the body's true hierarchy, not against it. And that creates a path to a deeper, more lasting recovery for absolutely everyone.